Hey everybody, welcome back to Ortho Nugs. In this video, we're going to discuss the rather complex subtalar joint. Let's first start by looking over the anatomy. So I've got my foot model here. This is would be a lateral view. This is the cuboid. Here's the base or the fifth metatarsal, the base of the fifth. Here's your calcaneus here. This is your talus. So as the name implies, subtalar is going to be inferior to the talus. So this articulation right here will be the subtalar joint. Now, if I grab my other model, we could look more specifically at the articulations that make up the subtalar joint. So I'm trying to get my fat fingers out of the way. As you can see, we've removed the midfoot and the distal aspect of the foot to look more closely at the subtalar joint. So here's our talus, here's our calcaneus. If we remove the talus and we look within the joint, so now this is a superior to inferior view of the subtalar joint or the superior calcaneus. So you can see we have three different articulations here. On the posterior aspect, and when we discuss the arthrokinematics and movement at the subtalar joint, we primarily are referring to the gliding and the accessory motion that occurs at this posterior articular facet. But we also have a medial articular facet here, and then this smaller anterior articular facet. So let's talk about the triplanar motions that occur at the subtalar joint. So we'll talk about this from a non-weight-bearing or open kinetic chain standpoint, and then a closed kinetic chain or weight-bearing standpoint. So the subtalar joint is known as a triplanar joint. So movement at the subtalar joint occurs in all three planes simultaneously. So there's a really strong coupling coefficient, which means that you can't just have motion in one plane. It has to occur in all three planes of motion. So the motions that primarily occur at the subtalar joint are going to be pronation and supination. There are three planes of motion that are associated with supination and pronation. So let's start with supination. The three planes of motion that occur with supination are inversion, plantar flexion, and adduction. Our students remember this by iPad: inversion, plantar flexion, and adduction. Again, this is in a non-weight-bearing position, so the talus is fixed and the calcaneus is moving on that fixed talus. I have a model here. I don't know how well you'll be able to see that, but supination, as a side note, we think of that as more of a high arch position, right? So this is more of a medial view of the foot here. So with supination, we will get inversion, and this is sort of fixed, so it's not extremely mobile to really demonstrate. But we will get inversion of the calcaneus on the fixed talus. We get plantar flexion, that would be the sagittal plane component, and then adduction, which is that direction, or the distal foot moves medial. Those are the three planes of motion: inversion, plantar flexion, and adduction, which are associated with supination. Now let's talk about pronation. So the three planes of motion that occur with pronation, and remember, pronation is more of a flat arch position. So the three motions that occur with pronation, again, this is in an open kinetic chain or in a non-weight-bearing position, will be dorsiflexion, eversion, and abduction. So the dorsiflexion component is the sagittal plane. Then we have eversion, so that would be the frontal plane, and then abduction would be the transverse plane. So our students remember that by remembering dorsivab: dorsiflexion, eversion, and abduction. So these motions we've just discussed, or the three planes of motion that occur at the subtalar joint, that was in a non-weight-bearing or an open kinetic chain position. Now the foot is on the floor. So the calcaneus is going to be fixed. So there's a little bit of a different way you need to remember that. Dorsivab and iPad don't necessarily apply anymore. Two of the motions are going to have to be different because the calcaneus is fixed. So let me just get into it so you can appreciate what I mean. So let's start with supination. So supination we previously described as iPad, inversion, plantar flexion, and adduction. Now the calcaneus is fixed, so this is in a weight-bearing position. So this is going to be movement of the talus on the fixed calcaneus. Now one of the motions will stay the same. Inversion will stay the same. So with supination, the calcaneus will still invert, but since the calcaneus is fixed, it can't plantar flex, and you can't get that adduction component. Instead, you're going to get the talus moving on the calcaneus. So instead of plantar flexion, which would be this, you're going to get dorsiflexion of the talus on the calcaneus, and then you're also going to get abduction, or movement, movement laterally of the talus on the calcaneus. So the way I remember that, again, just to review, the inversion component is the same. The calcaneus will still invert, but since the calcaneus is fixed, it can't plantar flex and adduct, so you're going to get dorsiflexion and abduction of the talus on the calcaneus. The way I remember that is that if you stand in a weight-bearing position and you lift your medial arch or put your foot in more of a supinated position, your tibia will tend to externally rotate. Well, what drives that external rotation of the tibia? It's that abduction, or lateral rotation of the talus on the calcaneus. Opposite holds true for pronation. So same thing, that frontal plane component in a weight-bearing position will remain the same. So we're still going to get eversion of the calcaneus, but instead of abduction and dorsiflexion, we're going to get plantar flexion of the talus on the calcaneus, and then we're also going to get a deduction. So we're going to get that internal rotation, or adduction movement of the talus on the calcaneus. The way I remember that component is, again, if you stand and you allow your medial arch to collapse, what happens to the tibia? The tibia internally rotates. The knees, the patella will move medially and internally rotate. Why does that occur in a weight-bearing position? Because the tibia has to follow that rotation, that medial rotation or adduction of the talus on the fixed calcaneus. So I know the subtalar joint can be fairly complex. Hopefully that brief overview of the three planes of motion that occur at the subtalar joint in both a weight-bearing closed kinetic chain versus non-weight-bearing open kinetic chain was helpful to you. Let me know if you have any questions in the comments. Please like this video if it was helpful, and don't forget to subscribe to our OrthoNugs channel. Thanks a lot.